Good afternoon, everyone, and I want to welcome you here to our beautiful Jacksonville Department of Public Safety. And we would like to welcome you to this roundtable discussion on opioid use in our community and throughout our state and nation. We are here to discuss this crisis that's in our community and look at some of the solutions in which we may be able to move forward to raise awareness and increase prevention measures. And I want to share with you some statistics we have here that illustrate just how critical finding solutions for this problem are. Nationwide, there are more than 14,000 substance abuse facilities and 1.27 million Americans receiving medication-assisted treatment for opioid use. There's 2 out of 3 drug overdose deaths in 2018 involved opioids. And in the last 10 years, and this is an incredible number here in my opinion, more than 28,000 North Carolinians lost their lives due to drug overdose. In 2020, an average of 9 people died every day in our state. Recently, our Director of Public Safety, Mike Gennaro, stated that in Onslow County last year, there were more deaths due to overdose than to suicide, homicide, and motor vehicle accidents all combined. Today's conversation will be an open discussion addressing this crisis, and our panel includes experts in the field that will share with us ideas of how we can all move forward to lower the number of deaths and addiction in our community due to opioids. I'd like to recognize some folks now that are here in attendance today. First off, I'd like to recognize our esteemed Attorney General here in the state of North Carolina, Josh Stein. We have District Attorney Ernie Lee. We have Onslow County Sheriff Hans Miller, Director of Public Safety Mike Gennaro. We have our Fire Chief, T. Tallman, our new City Manager as of, 3 weeks now, Josh Ray, and our Director of Neighborhood Improvement Services, Tracy Jackson. Also, we have with us today Councilmember Cindy Edwards, Councilmember Bob Warden, Senator Mike Lazaro, Commissioner Robin Knapp, Commissioner Mark Price, City Council Member Brian Jackson, and we also have Commissioner Tim Foster with us. Many of you know our next speaker. He is a retired school principal who served 30 years with the Onslow County Schools, and he is an active leader in our community and serves as Vice Chairman of the Onslow County Board of Commissioners. We are pleased to welcome here today Vice Chairman Tim Foster to our panel discussion. Tim.
Thank you, sir. Thank you, Mr. Mayor, Mr. Phillips. 30 years in the Onslow County school system, we see firsthand what's taking place. So with that being said, I'd just like to, on behalf of Chairman Jack Bright, who sends his regrets, he had a prior commitment and could not be here today, on behalf of himself, Onslow County, and the Board of Commissioners, we welcome you here today. In particular, we welcome our Attorney General, Mr. Josh Stein, to Onslow County and the city of Jacksonville. This is an important discussion on opioids, the settlement, and where do we go from here. These efforts will be paramount to the success of where we go in the direction that we take. Without this discussion, without this effort, then we'll continue to swim in the same waters with the same results. No one wakes up and says, today is the day that I want to become addicted. It doesn't happen that way. But here we are in the aftermath of an opioid epidemic. that has caused problems that are most often related to crimes in our city and in our county. Often, those are some of the most violent crimes that we face as a result of these addictions. And as I said previously, no one wakes up and says, today's the day that this is what I want to experience and I want my family to experience. So today, we take this conversation, this discussion, to move this forward, to save the lives of those that have not been impacted yet, to change the lives of those that have been impacted, and make a difference not only here in Onslow County and the city of Jacksonville, but statewide and nationwide. Again, thank you, welcome, and let's make this discussion important and a changing opportunity. Thank you.
Thank you, Tim. Our next speaker traveled several hours to be with us today and is the 50th person to serve as the Attorney General of North Carolina. He has served in this capacity since 2017 and is focused on protecting North Carolina families from crime, addiction, and consumer fraud. He is a former state senator and was also the senior deputy attorney general for the state. He has led the fight to put more criminals behind bars, wrote the School Safety Act, and works to protect our youth from predators. One of his top priorities as Attorney General is to address the opioid crisis in our state. He is here today to share how state leaders and the healthcare system is tackling this problem of opioid abuse. Please welcome North Carolina Attorney General Josh Stein.
Mayor Phillips, thank you for that those kind words of welcome, and Commissioner Foster, thank you for your important words as well. We've actually been in this room together in the past. We were here probably 5 years ago talking about this issue, and at that time we were talking about the state being awash in these pills. And I remember there was a gentleman who was sitting back there who told us his story. There were a couple stories I remember from that day. One was a gentleman who had been on a motorcycle and crashed and messed up his knee and was prescribed pills, and he said that by the 5th day he knew he was gone. And he said it was a 14-year journey to the darkest places that he'd ever seen or could imagine before he came back, and then he was helping other people. And there was a gentleman, an elderly gentleman, who said that his wife had been prescribed pills and that she too had become dependent on them because there were just too many pills. And so Senator Lazara knows the legislature tackled this issue in a bipartisan fashion. We championed the STOP Act to reduce the overprescribing of the medication, and it passed unanimously. Governor signed it into law. So this is an issue where, thank goodness, we set aside the party stuff that is too noisy, too divisive, and we focused on trying to help people. And that's what we've been about at the Department of Justice. I want to, of course, give my appreciation to Chief Yanero. He's been working on this issue for so long and with such a servant's heart, and we all should appreciate it. Sheriff Miller as well. Thank you very much. We heard some statistics about just how deadly this is, and it is the deadliest moment and the deadliest drug epidemic in American history. Last year, it was over 100,000 Americans, 108,000 died of an overdose. We've never seen numbers anything like that, and it's a record we never want to see broken before. But it's a continuation of a trend. The increase in overdose deaths from 2019 to 2020 was 40% in a single year. It's almost difficult to imagine the scale and scope of this crisis. And Onslow County has not been untouched, as you all well know. 53 overdose deaths in 2020, more than 200 visits to the emergency department for people who've experienced an overdose. And Chief Yanero's statistic that he shared with me before we came in here, to have more people die of an overdose than car crashes, plus homicides, plus suicides, is staggering. It is staggering. How did we get here? How did we get to this point? And tragically, my view is it was predominantly greed. These drug companies in the late 1990s and early 2000s convince the healthcare profession, the medical community, of two things. One, that opioids were the most effective way to treat pain, and two, they were not addictive. And we now know that neither of those things are true. And America has been paying the price ever since. So I helped put together a national bipartisan coalition because these drug companies made billions and billions and billions of dollars while millions of Americans were getting hooked. So this national bipartisan coalition of nearly every attorney general in the country took Purdue Pharma and the Sackler family, took the drug distributors, took drug stores, took them to court, investigated them, negotiated with them, and we achieved the $26 billion national opioid settlement that we announced last year. We have settlements in principle with 3 other drug manufacturers, generic drug manufacturers, that are going to add another $8 billion to that $26 billion. And we have other companies with which we are in negotiations. And so we're not done yet. But the $26 billion, that's already started to flow. In fact, the first 2 payments have been made. It's about $60 million have been made to the state so far. And another $30 million is coming in this year. And then, of course, this is going to go on for 18 years. Of the $26 billion, North Carolina's overall share is $750 million. And I, of course, want to thank the Onslow County Commission because you all immediately got on board with us, as well as the Jacksonville City Council. And because we had unanimity, every county and every big city in the state, we're getting our full share, the $750 million. And one thing that we did when we were talking with the county commissions about this was we made a conscious decision that this is a crisis primarily felt at the local level. Y'all are the ones that have to deal with it. It's in your jails, Sheriff. It's in your cars, police cars, Chief. It's in the fire and EMT having to do the Narcan recoveries. It's your social services. Y'all are the ones who have to deal with it. So we made a decision that we wanted most of the money to go to local governments. So that's 15% is going to go to the state, 85% go to counties and big cities around North Carolina. But regardless of which level of government gets it, whether it is the state or you all, the local governments, it has to go to attack the crisis. It was important that we secure meaningful sums from these companies to hold them accountable for their wrongdoing, but it doesn't mean anything if we can't help save lives. And so making sure that the money goes to attack the crisis was paramount. We put in all kinds of language. It can't go to filling potholes. It can't go to tax relief. It can't go to anything else other than helping people who are struggling with this crisis. Prevention, treatment, recovery services, harm reduction. Those are the permissible uses as broad categories. And when you kind of subdivide it, there's a lot of stuff that is permissible within that. Evidence-based treatment options like medication-assisted therapies, recovery support services, housing, employment, transportation, naloxone distribution, post-overdose response teams, syringe service programs. The sheriff knows about treatment options for people who are incarcerated in the jail, diversion programs, which the chief has been a statewide leader on. When you encounter somebody with addiction and they meet certain criteria, get them into the healthcare system where we can address their problems. Don't and put them up in the criminal justice system where you're just putting them behind the 8 ball. And you're costing your taxpayers dearly to have them incarcerated. So those are all types of initiatives that are permissible for use for when you all decide how to allocate it. And what I've been doing is having meetings like this around the state so I can learn what are you all thinking about doing, what are some of the initiatives. Many counties, like we just came this morning from Carteret, they said we're in a comprehensive strategy development process where we're meeting with all the players, we're finding out what our assets are, what are our gaps, and so we're not going to make our appropriations decisions until we have a real sense of what the plan is. Other counties are ready to start investing, and they're doing post-overdose response teams so that when somebody has an overdose, there's somebody who can come in 24 to 48 hours afterwards and try to connect that person to service so that we can break that cycle of addiction. So there's all manner of things going on around the state that is really very impressive. I know that you all have the community paramedic program. I know that you, in fact, after we did this roundtable, Chief had me back for the ribbon cutting for the detox facility Dick's, what's it called? Dick's Crisis Center, which, what a wonderful example of county collaboration. You know, maybe it's too expensive for one county to carry, but if you talk to your neighboring counties, and I was talking to the folks in Carteret, and they were saying how grateful they were to be able to use some of the beds that you have there, although they lamented, like I'm sure you do, it's never enough. It's never enough. So you all have been tackling this crisis creatively for years, and now you have an opportunity to really accelerate and expand what you're doing as you try to help your community. We have a tool that we've created called the Community Opioid Resource Engine of North Carolina, which is Core NC. The website is ncopioidsettlement.org. And the website does a few things. One is it has a lot of ideas that counties like you are doing all across North Carolina, because we don't have to reinvent the wheel. We just have to know what works and fund that. Two, it has all kinds of useful data, like what is the overdose death rate in your county compared to other counties? What were the opioid prescription rates compared to other counties? What are the social determinants of health compared to other counties? Just useful information. And then the third part that's going to be very important, and this is really for the taxpayers, is there's going to be an investments dashboard. So whatever decision the county makes or the city makes with its share, we're going to report that to the people so that we know exactly who was funded, how much did they get, and critically, what were the outcomes? What did we achieve with that investment? Because if you do something for 2 years and it isn't producing results, fund something that is, because there are a lot of good ideas that we know will work. And this is a way, this transparency is a way to get the public involved and really help the community leaders use this funding in the best way possible. There's a great resource at the Association of County Commissioners, a woman named Nidhi Sachdeva. I don't know if y'all have connected with her yet, but she is an expert and she knows everything that's going on around the state, and she can help you think through your strategic plan. That was a great use of some of the funding that we've achieved. So as I've been traveling around the state, and I know it is true of those of you in this room, that there's just incredible passion and dedication to trying to help other people, help people stay alive and get to a place where they have a happier and healthier life. And I know that there are people who have been touched either personally themselves or through their loved ones or their neighbors or friends. I mean, this is just a heartbreaking situation. And when you combine that kind of passion, dedication, and creativity with a new stream of dedicated resources, I know we're going to be able to do even more. And that's why, even though we're at a bleak moment, I'm optimistic for what we're going to be able to achieve in the coming years. And I want to thank you for having me today. Let us resolve to make sure that there are more people alive and healthy next year and the year after that and the year after that than otherwise would be, but for the work you all are going to be doing here. And thank you so much for having me.
This time, I'd like to recognize Sherry Slater, Deputy County Manager, and she's going to tell us a little about the SOAR program. Sure.
Good afternoon. I'm a proponent of lifelong learning. I think you should learn something new every day. What I learned today is not to speak behind the Attorney General in the future. I was like, oh, no, he said that. Okay. But anyway, thanks for having us, and thank you all for hosting, Mayor. Onslow County has tried very hard for most of my career to be progressive and to pay attention to the issues and to make decisions that will actually impact and have outcomes that we desire. As a part of that, when the opioid settlement funds came down, the county had some options based on the way the memorandums were written. And one option was to take, as the Attorney General said, to take from the list of items and start immediately with those types of services. Another option that was given was to have a very comprehensive and very laborious process of looking into your community and the gaps and needs and trying to figure out what your strategic plan would be. The commissioners decided that we have done a lot, as you've heard already lamented on the things that have been done in our community. We've, in partnership with the city and with our neighboring counties, we've gone after many grants. We've started numerous programs in the detention center, out in the community with our community paramedics, with our mobile crisis teams. We've worked really hard in our community to put forth programs that will make a difference in this crisis, and I think we've made some headway. We got a lot more to make. With that in mind, though, the commissioners also wanted to have the input of the experts, and so several years ago, the city and the county together created a team called SOAR, which is our Strategic Opioid Advanced Response, and that team has continued to advise both the city and the county, and actually to some degree some of our neighboring counties that have worked with us on that's nice, it's a little background music, to continue to advise us on what's actually going on in the community with respect to opioid and other substance use disorders, what the true picture is of our overdoses in this community, and what things are working and what's not. And so to that end, our opioid response team came together, worked on what the MOU said we could. We looked at what the MOU said we could do. We looked at our data and made some decisions about what we wanted to prioritize. And that report is some of the stuff I'm going to speak about today. Now, we did just finish these meetings last week, so you'll see some of my fellow teammates here today as well, and they'll jump in and add wherever I maybe don't complete a thought, or they can add some additional information. What we did is pulled this community team together, which consisted of folks like myself, folks from the city and county government. We also pulled together folks from community organizations, faith groups. We have some families of addicts on our team. We also have some folks who are actually credentialed to do the work that we're talking about doing. Some providers were on the team. It's very important to understand our agreement and our mission when we started this project was that providers were there as a resource of what they're actually seeing on the ground, not as a company that's looking to get money in this process. They understood that, and they were okay with that because, again, they're part of our community and they want to be part of the solution. So that's kind of where we are. As you heard, North Carolina received some funds in the opioid settlement. Onslow County was fortunate to receive just a little over $10.5 million of that. It sounds like a lot of money. People who know me will tell you I could probably find a way to spend it. But $10.5 million over 18 years is not as much money. So the group looked at how would we spend about $500,000 a year, and how far will that money go if we have to, drag it out over that amount of time, so we make sure that we're getting the most for our buck here. In reviewing the 12 potential strategies under option A, our team determined that the best course of action would be to prioritize those options or those services, and then to make those recommendations to the commissioners based on what we already have available in the community, what we think we need in the community, and where we need to beef up some things that already exist. So that's kind of where we are today. We reviewed relevant data from the last several years. We identified the gaps in existing services in our continuum of care. We identified what we considered the ideal continuum of services going forward for substance use disorders, and then we participated in ranking those by priority so that we could make those recommendations. The group also felt like, as you heard, as I said, the AG, you said a lot of things, sir, that I planned to say. I appreciate that. That's okay. But one thing that he shared is you can't do something forever and not check to see if it's working. That's not a good use of our resources. So in this case, we built into our system an annual review of the programs, an annual review of the data and the outcomes to actually determine what's working, what we need to change, or what we need to scrap altogether. So this is not a one and done. This group or some version of it will continue to meet at least on an annual basis to review the data and make determinations about recommendations going forward for funding And the hope is maybe some of those outcomes will be so good that those services won't be needed anymore, and we'll find another way to impact in another area. With that in mind, let's see. The number one category that our team felt like needed to be addressed in our community was adolescent early intervention services. Again, on this team, the school board, Brendan Gardner was not able to be here today, but he is part of our Board of Education and wanted to send his regrets for not being able to make the meeting. But we did work diligently with the school system on the types of services that might be implemented for our youth, which would also be done in conjunction with public health as we get those messages out on those health indicators, social health indicators. The word's not coming, sir, I'm sorry. Our second priority was to focus on evidence-based addiction treatment services. We know that in Onslow County, we're certainly missing our long-term treatment services. We don't have any inpatient long-term treatment, and we don't have sufficient outpatient long-term treatment. The folks that are working in those services are doing what they can, but there just isn't enough capacity to see people in a timely fashion. I think we look at, and Dr. Gilbert, correct me if I get this wrong, 5 to 7 days for people to get an outpatient visit is not uncommon. 5 to 7 days when you're in crisis is too long. We got to find a better way. So that is a big deal for our group. We also have our medication-assisted treatment in the detention center. It's a brand new program, and thankfully our sheriff and staff are very forward-thinking and doing things that not a lot of communities are doing. When we release folks from the detention center, if they were using before they came in, and then they dry out by virtue of the fact that they've had a nice little stay at the end, they're more susceptible to overdose when they get out. And we don't want that. We want them to be as well prepared as possible. We want them to be hooked up with that appointment when they get out of the detention center. And so those are things we've been working on with our case manager at the detention center, but adding the medication-assisted treatment to that is one more step in having those folks be stable enough to make it to that next appointment and not end up back in the same situation or something worse. The third priority that the group came up with is the evidence-based recovery support services, with an emphasis on peer support specialists, which you all know we have peer support in our community paramedics program. The Dix Crisis Center has some peer support and peer navigators. That is a system, a component of our system that has worked very well. It's not been very well funded in the past, so we are trying to increase that and make a more comprehensive system under the evidence-based recovery support. The fourth priority that the group designated was recovery housing. Recovery housing, there are some available in Onslow County, not enough. Long-term beds in recovery, not enough. So those are things that we will be exploring how we can either bring more of that to Onslow County or how we can access more capacity in those services. And the fifth and final priority that we listed in our plan is the post-overdose response team. Again, we have some post-overdose response in our community, but those are not services that have been historically very well funded. And I think our working group has done a good job identifying where we could beef those up and what recommendations they're making then to the commissioners on ways to further fund those services and have an impact on the community. I do want to add, as we talk about this plan, we're through with the work group's work for this year. The plan itself will be out in just a week or so in its full version, but this group will continue to work. It's really, the work is not probably ever over. And if we can beat opioids, we'll pick a different topic down the road to tackle, because this is a group that wants to do things and wants to be proactive in our community. So we still have lots of work to do, but those are the priorities that were identified by the work group, and those are the priorities that county staff in particular will be researching and doing requests for proposals for the services that will fit into those priorities. I would like to just kind of say to the team, if y'all have something to add or any comments you want to make, I'd be happy to turn that over to you, as you all did a lot of really hard work. They're all so shy now. That's okay. That's all right. But I want to thank you all for the opportunity, and I want to thank publicly our SOAR subcommittee for everything they did. Sid Wyford with ACT Associates has sort of helped us through this process and done a tremendous amount of data crunching and presenting for us and keeping the squirrels all in the right place in our meetings. And so thank you, Sid, for everything you guys have done. And thank you all for the opportunity to share this information. We hope to share more with you soon.
Sherry,
Yes,
why don't
sir.
you take a moment and introduce your team?
Absolutely. So I'll go right around the room. Dr. Toby Gilbert is on our team, Heather Perkins and Tracy Jackson, and Joe Dwayne, Chrissy Hoover, Sid Wyford, of course, our illustrious leader, Aaron McDonald, and Angie Todd from our group, and Colonel Chris Thomas. I think that's everyone that was. Do I have other folks? Not pictured, not in the room, would be our representative Brenda Garner from the school system. Julia Neal from the Dix Crisis Center was on our team. We did have representatives from Hope for the Warriors. Karen Reeves from Trillium was on our team. Christina from One Place was also there. And then our DSS director, Carrie Sanders, was a part of that group as well. Who'd I miss? Or what
I'd
I
just
miss?
like to add,
Yes.
I'm not an Onslow County resident, official Onslow County resident. And I worked with Onslow County for several years on various projects, adolescent suicide a couple of years ago when you had some spikes in that, and the Dix Crisis Center, and I'm currently working with a couple other counties, Lake and Columbus, on the opioid settlement work. Onslow County is really a unique place, if you don't know that already. And it's really unique to have a wide variety of professionals around the table and not be scrapping over dollars, but to really rise to that higher purpose of what is it we have to do to make Onslow County and Jacksonville a better place to live. And to a person, to a meeting, to a fault, it doesn't matter what the topic is, that's what occurs when you walk in from the outside, and that's what you see. And so my personal thanks to the committee for the hard work. You know, we did some number crunching, but by and large, the data came from the committee. It didn't come because I generated it. It came because people were really interested in pulling their own numbers and taking a close look. So kudos to the county, kudos to certainly the AG's office for putting this together. But Onslow County is a really unique place, and we ought to celebrate that as we attempt to meet this challenge.
I was going to echo that. I just have to tell you that our office was the office that drafted the appendix to the national opioid settlement, like 12, 13 pages of ideas of how the money could be used. We then negotiated extensively with the County Commissioners Association about processes by which we thought that the county should go through in order to use the money effectively. What you've just described is the vision. It's the poster child of what it is we were hoping for. We know it's not going to be enough money. We wish it were enough to solve it, which means that the money that you do have, it really raises the stakes on spending it well so that it makes as big an impact. And to hear the process you all went through by having such a wide group of stakeholders participate in making the recommendations and then coming up with a plan that's based on where you think it has the most impact. Because every one of these ideas is worthy. So I really am very impressed and very excited to see what you all can do. One thing on the treatment front, I'll just say, because we want there to be more treatment, inpatient treatment, even outpatient treatment, but most people don't provide services for free. I mean, all of you do what you do, and you get paid for it. And we expect in this country for people to get paid for it. And if we want more treatment providers to exist, we have to be able to compensate them for that work. And that's why the fact we have 1 million uninsured North Carolinians is so damaging, because we have an opportunity at this very moment where we have the President Pro Tem of the Senate, we have the Speaker of the House, and we have the Governor all in agreement that this state would benefit immensely if we expanded Medicaid. If we expanded Medicaid, that's like 600,000 people who don't have insurance would now have insurance, which means, and a lot of it, you talk to folks who serve this population, this is not an insured population. I assure you of that. That if you talk to people who provide the service, if folks could get insurance, then when they need the care, the people could get paid, so more providers will come to North Carolina as a result. You know, I think it was in Orange County. They have a really good program called the Lantern Program. They actually work to get their county inmates Medicaid. And they do the MAT in jail, but once they have the insurance, when they get out, they can then pay for the services that they need. And so the funds that we've raised, $750 million, when you spread it out over all the counties over all the years, it's not enough. But there are other sources of funding, like our tax money that we've already sent to Washington, that can come back in the form of insurance. Make a huge difference, huge difference. Thank you,
Mr.
Sheriff.
Mayor, and we'll turn it back to you.
I'm going to ask Senator Lazara to come up and say a few words. And
Thank you. Thank you, and thank you for allowing me to be here today. It's certainly an honor, and especially to echo our Attorney General's comments in terms of nonpartisan. And I will tell you, I've been around since we did a lot of this work, and you have been instrumental in this effort for many years, and you've done an amazing job in battling the drug companies to bring home a lot of money that we can save a lot of lives with. And I want to personally thank you, because I think that you will accomplish that. And I also am very proud of our county and our city on the amount of work that they've done over the years working together to create the crisis center and focus on this issue that's devastating our country. It's destroying families, and in spite of all the work that's being done, it continues to get worse. It's not getting better. So we have to work that much harder. And there are so many examples that are being set in so many different areas, and today we've mentioned so many, but we still have so much work to do. I just attended a tour of the Cherokee Nation. I'm not sure if you've had the opportunity to visit their hospital system, but they've built an incredible hospital system that's all inclusive. So as part of this hospital system, they have dental clinic, they have a recovery center, which would be an equivalent to our Dix Crisis Center as part of this facility, and then they have a continuum of care so if someone goes to the emergency room and they're struggling and they're in crisis, they go to what we'll call the detox within their center, and after the 3 to 5 days, they will go to their long-term facility. So very impressive. And anybody that has been around opioids, I think the fact is that we have to recognize that long-term treatment is the only solution. If we want to save lives, we've got to figure out how to get people stabilized and into long-term care. And I think that's something that we've got to continue to have a conversation on. And I also agree with your comments on Medicaid expansion. And I think CON is another piece that I think would be helpful. For example, we have a 14-bed facility. If we had the funds and revenues to expand it, we don't need the authority to do that. And I think that would resonate across the state, because we've got some funding that I was able to secure this year, $3 million just sitting there that we can't use, that we were going to use for the 23-hour facility, but we can't make it work right now. So there's many examples of that, and I guess in summary what I will say is that we have a lot of work to do, but you have a General Assembly, and I think in a bipartisan way, a really strong effort to make this thing happen so that we can try to save lives. And my motto has always been, if we can save one life, we've done our job. And so we've got to continue to work hard. We've got to continue to work together. And I just want to thank the city and the county and your Attorney General's office, and especially you, Josh, for the work that you've done and your passion for it. So thank you very much.
Well, we've gotten some good information today on this project, on this problem we have. You know, having been a law enforcement officer for 30 years during the 70s, 80s, and 90s, you know, we had drugs, and some of my colleagues can probably relate to this, but we never have seen anything like what we're seeing now. It's epidemic in proportion, and the bad thing about it, it doesn't realize any boundaries at all. It doesn't matter what your race is, what your age is, what your religion is. You know, it doesn't respect family lines. I mean, all of us are susceptible to experiencing, you know, the sorrow that we see in some of these cases that you hear about. And, you know, it's great to see this group here together and the work that y'all done as a committee, you know, to attack this problem. And it has to be attacked, and we're gonna have to stop it. But that's enough for me, but I do want to thank everybody for coming today. And I want to give special thanks to our Attorney General, Josh Stein, for coming to be with us today. I know that he's avid about this, you know, attacking this problem and trying to bring it under control. And thank you very much, sir. Y'all have a great day. Thank you for coming.